That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr. Abdelaziz Khayyab, and with us today is Monica Habashy. Welcome to the show.
Hi, thank you.
To let you guys know, this is the first episode where usually I like to prepare like a little list of questions for our guest. But the reason why this time I decided, you know what? Let's not do that. It's because Monica and I go way back. We've been friends since high school here in Kuwait. And the reason I invited her onto the show is because I think it would be super interesting. Basically, we both came from similar backgrounds here in Kuwait educationally. She was in AIS and I was in ASK, so rivals, but still similar friend groups, similar education, curriculum, stuff like that. And I, of course, went into medicine, and Monica was initially going as a pre-med student into college. We're going to dive into that. But then she hit the brakes, pulled the side brakes on us, and went to dentistry. And she's due to graduate from UCLA's School of Dentistry in June of 2024.
June 2, 2024, yes.
Super exciting.
Yes.
I'm going to get rid of this AC remote. I'm going to shove that into my pocket right there. It's not an episode if one thing doesn't go wrong. So just so you guys also are aware, I am fresh off and on call for my surgery buddies out there. It was ACS week. And to those who are on my team, a shout out to you guys. You know who you are. It was a very intense week. So I am half dead, and this coffee is much needed. So, Monica, first of all, we always like to talk about the coffee on the show. And then before we get into our partners and the episode, so tell me, what do you think of our coffee today?
Honestly, it's great. It's the little pick-me-up I needed since I just got off a flight not too long ago. So, thank you.
Tell us, what do you think about the mugs, right?
Oh my God, it's so cute. I love the logo. Yeah. It is actually everything. And let's brew together.
Fun fact. So this QR code right there, you can scan it and they'll take you to the Instagram page.
Oh my God, I love that.
Very cute, right? Yeah.
Yeah.
The coffee is a pick-me-up that we both needed. And I can tell you that during this week, the amount of coffee I was drinking was unreal.
I can't even imagine.
It was bad. I switched to Turkish coffee recently for a little bit. I've been really enjoying the Turkish coffee. I don't know, and just like regular coffee, I started drinking. It was I used to drink like sugary type coffee when I first started. Turkish now I'm weaned off completely because sugar. All the studies on sugar and its potentials for cancer and literally every other bad thing freaked me out.
That's fair. That's fair. Yeah.
So let's dive into the meat of the episode. Let's talk a little bit about, high school, medicine, dentistry. We really want to get into why should we go into medicine? Why should we go into dentistry in this episode?
Right.
Because, it's going to be a bit of back and forth from kind of two youngins in the industry.
That's fair. Yeah.
So first of all, tell me why even something healthcare? Where did that start in high school? You were even more... I think in terms of healthcare, you wanted to go into healthcare before me.
Yeah. So both my parents are doctors, right? So my dad's a cardiologist, my mom's an anesthesiologist. And so growing up, I always saw them in the healthcare field. And I always saw how rewarding it was to kind of just see a patient through with like all of their needs, right? Watch someone get better and like play an integral role in making someone feel better. And I always wanted to go into healthcare for that reason. I really liked how rewarding it was. I was super interested in science always. And so up until I think the end of my first year of college, I was super pre-med. I went into college and I was like, those like gunner pre-meds.
I remember.
Yeah. I did all the clubs and everything, and I was just doing a lot of volunteer work. And I realized after going to UCLA for undergrad was that there's a lot more to healthcare than just medicine, right? I think growing up for the longest time and seeing my parents both doctors, that's all I knew. And so when I went, I was like, okay, that's what I want, right? I want to really help people. Like I want to make a difference in people's lives. And I realized there's so many other outlets. And I think slowly getting more and more involved in different healthcare opportunities allowed me to see what's out there and slowly start to think, okay, maybe not specifically medicine, but something else in medicine, right? And so I think after my first year of college, I came back to Kuwait for summer, and I wanted to do something to boost my resume, right? Like I'm going to apply to medical school. I really want something on there. And so I asked my mom if I could intern at the hospital that she worked at. And
Where?
so KOC, Al Ahmadi Hospital.
Okay. Yeah.
Right. So at the time,
It makes a difference, by the way, contextually, which hospital. Like,
oh yes,
yeah,
yeah. There we go. So
Yeah.
she was able to. They used to have. I don't know if they still have that, but this was like 7 years ago. They had this internship program where college students could come and kind of just shadow physicians in different departments. And one of those departments happened to be dentistry, because hospital-based dentistry is huge in the Middle East.
Yeah.
And so when I heard that one of my rotations was going to be in the dental offices, I was a little upset, because I was just very against the idea of, dentistry or like working in someone's mouth. I was like, that's going to be really weird. I don't want to do that. I was actually really upset.
Yeah.
Really upset.
Yeah.
Okay. Yeah. So day one, I'm already upset. And my day one, rotation one, was dentistry. So I was like, okay, fine. I sucked it up. I went in, and I remember so well, my first day was in the pediatric clinic. And even worse,
They're
right? I was
screaming,
expecting the screaming and the crying and
Yeah.
everything. And I walked in, and the doctor just knew exactly what to say to the patient to get her to sit down, sit for an exam, sit for like a couple x-ray films, and actually do a small like minor cleaning. And the patient was actually really happy, and she was excited, and she wanted to come back. And I was like, okay, I guess maybe this is an anomaly. Like, this isn't normal, right? Next day, we were in the oral surgeon's clinic, and he was doing extractions. I was like, this is for sure going to be disgusting. There's going to be lots of crying, lots of blood. It's going to be gross.
All pediatric patients.
No, this was more like, teens, wisdom teeth extractions.
But still
things
pediatric.
Like still young, yeah.
Yeah.
So I'm there, like, holding the gauze, right? And it was not that bad. I was like, okay, that's not bad at all. Like, this is kind of interesting. Third day, I was in like the general clinic. So I was like watching, them, like I was watching the dentist like do a filling, and then like a patient's like front tooth chipped. So he like just did a small filling in the front for her. And she was really, really happy. And I was like, wow, like you could see the results right away, right? Like we were able to fix that chip, like extract that tooth all instantly. And I was like, this isn't as gross as I thought it would be. I was starting to be like a little more intrigued. And then the next week, I started in the pediatric clinics in the hospital, and I started to see sick children. And that...
Wait, what do you mean? Sorry. There's going to be a bit of doctor versus dentist ribbing here.
Yes.
What do you mean sick? You guys don't get sick.
So they were just not in optimal health. Let's say that. So I don't remember what like conditions they had. Honestly, I don't remember.
Chronic or acute?
Some were chronic, some were acute.
Okay, so mixed.
Yeah, mixed. So this was morning rounds in the...
you guys have rounds?
This was at KOC still. Yeah. I like went as an intern
Dentists
to the
have
round.
have
No,
rounds?
this was like in the hospital. Like,
oh, right.
Yeah,
okay,
yeah. This was like, we're done. I finished my first week was the dental. It was chill. It was beautiful. Loved it.
Okay,
right?
Perfect.
Second week, we started in the pediatric clinic in the hospital.
Oh, wait. So that's what you meant by sick?
Yeah.
Okay.
Yeah,
I thought
yeah,
you meant dentists.
No.
Okay,
Right. So they were like sick children in the hospital.
Oh, that's the worst.
Yeah. We were doing rounds, and I was really, really upset. I just like, I went back to my mom's office, and I was like,
wait, you were upset?
Yeah, I was sad.
That's actually really surprising.
Yeah. I went back to my mom's office, and I was like, do I have to go back? And she was like, yeah, do you want the signature? And I was like, yeah, but can we just skip this, rotation? And she was like, no, you have to do them all. And I was like, okay, fine.
It's surprising because pediatrics are the healthiest ones.
Oh my God. I wish I saw healthy kids. It was rough. So just, did a round, went through the day, and I just was bummed. Honestly, I thought I would have a lot more fun in the hospital than I had in the dental clinics, but that was not the case. The day after that, I went into surgery, and I was like standing there, and it was like someone who had scoliosis, and they were putting like screws and stuff in their back, and it was like a 6-hour-long surgery.
Oh, orthopedics.
Oh my God.
Yeah.
So that was another like traumatic experience. And I guess like the rest of my internship, I just no longer was enjoying it. It kind of set the tone for me, and I was like, I don't know if I want to do this anymore. But I didn't want to back out just yet because, like we said, it's all I've wanted to do since maybe 7th or 8th grade, right? So went back to the US and I was like, okay, I'm going to keep this dental door open. I'll still shadow some dentists.
You were, and at the time, remember, for a lot of people here in the Middle East, pre-med as another degree is a bit of a foreign concept here.
Yeah. So in the US, it's kind of interesting because it's not like pre-med isn't the major. In some schools, it is a major.
But what are you going to do with it?
Yeah. So in UCLA, I was psychobiology. So my major was psych and bio classes.
You never told me that.
Yeah, psychobio. Yeah, so it was kind of cool.
That sounds like a good show.
Yeah,
psychobio.
Yeah, honestly. But the major wasn't as cool as I thought it would be. I thought it would be an actual mix of psych and bio in classes, but it was literally just half psych classes, half bio classes. And so I guess that's like the good thing about going to school in the US is you don't go with like, this is the set path, like I'm pre-med and I'm done.
Yeah.
You can switch. And I'm glad that I had that opportunity to explore what I wanted to do in those first 4 years of undergrad before dental school, because I wouldn't have realized that I wanted to go to dental school and not medical school, right? And so I went back and I was still doing, my like volunteering work. I was still shadowing at the dental clinics and I was still, involved in healthcare. And one of the clubs that I was a part of, we actually like drove down from Los Angeles to Mexico and did like healthcare screenings. And sometimes we would take with us like mobile dental clinic or like a mobile vision clinic or whatever. And one day we had a mobile dental clinic come along. And surprisingly, there were a lot more people there than when we do the healthcare screenings.
Okay.
And when we ask them why, it's because, when we have money to spare or to spend, we're not going to spend it on teeth. We're going to go...
not on teeth?
No, because these are free services.
Okay.
So they're like, we're not going to spend them on our teeth. We're going to go to the doctor. We're going to buy other things that we need, right? Because our health is more important than our teeth. And no one really goes to the dental clinic and pays money for it. So if it's free, they're going to come for sure, right?
Sure, yeah.
Because no one goes to the dentist unless they're in pain. And it's too late at that point when they're in pain. And I think that's something that I started to really think about was, okay, there's all these aspects of healthcare and your mouth is a part of your body, right? Yes. But why is the emphasis always on our like physical body and our physical ailments, and we're not as focused on our teeth or
let me challenge you with that.
Yes.
By the way, a lot of what I'm going to talk about in this episode is going to be less about my own opinions, but more like the views, the stigma, all of that stuff, because I'm sure that factored in your brain when you were thinking
100%.
And I'm sure that a lot of people making the decision between medicine or dentistry are thinking of these things. Let's imagine healthcare is a burger, right? Mm-hmm. Would medicine be the meat? And then kind of dentistry is just one of the toppings. It's important. It's not, listen, nobody wants a dry burger. But it's not,
Look, I do understand a lot of times, and I think even my parents would, take your side and say, yeah, like your health is way more important than your mouth and like what's going on with your teeth, right? But I think what a lot of people fail to realize is that your mouth and your teeth is still a part of your body. If you have an infection in your mouth, that can go and spread to the rest of your body, right? Yeah, a lot of health diseases can show up in your mouth, right? Mm-hmm. Like you can see your dentist can identify a lot of health issues just by looking in your mouth, right? Mm-hmm. Looking at your tongue, looking at just different aspects of it, right? So I think it's not mutually exclusive. I do see why people prioritize their health more than their oral health, right? Yeah. But I think it's time for us to also just emphasize the importance of making sure that we also have a healthy mouth, because like you have a healthy mouth, you're going to have a healthy body overall, right? Mm-hmm. Like it's still super important. And that's something that I try so hard to emphasize with my parents as well and my family, because they're all, I have a lot of doctors in my family, like physicians, mm-hmm. but again, they always look at dentists and they're like, oh, like you're not a real doctor, or dentists or like teeth aren't really important, right? But I disagree. I think if you really like think about it, and if you really look at the studies and look at the things that are done, and a lot of times doctors will send patients to the dentist to get clearance for certain medical procedures because it's not, disconnected. Like they do have impacts on each other. And I think it's really important to switch that narrative and kind of focus more on like the collaboration rather than, oh, like this is important and you're just like a topping on the side.
So, okay, let me challenge you again though. Okay. Is it fair for, again, I keep saying this because I know someone is going to be listening and feel offended. Guys, I do not believe in the majority of what I'm talking about right now. I'm trying to get a point across, because if we don't be blunt about some of these conversations, my hope is that someone is watching who's like a high school kid and deciding what they want to do. And I want to be blunt about this stuff, right? Do you think it's fair for dentists to be considered doctors, okay, if they don't go to medical school?
Well, let me tell you this. My first 2 years of school, dental school at UCLA, I was taking medical school courses.
Yeah, but that's pre-clin. Pre-clin, like, listen. We don't... Like,
no, I think we
why do you think step one was turned into pass-fail? Because there was a huge argument. So step one, USMLE step one is preclinical. Step two is clinical. And in step one, a lot of people argued and they got annoyed. They're saying that I'm putting all this studying into this one exam that hardly, it's a foundation, but it hardly plays into kind of my practice, if we go into like day to day and whatever. So like, do you think it's fair?
That what?
Like you guys do the first 2 years, right?
Yes.
But is it fair to say that, you guys are doctors if you're not doing the whole med school?
We are doctors.
Tell me. I believe you're doctors, by the way. I'm just saying, like, tell me why.
I just think, like everyone has their own specialty. Like you're a psychiatrist, you're a whatever, right? And I think we're doctors of teeth. Like we are doctors of dental surgery. Like that's the degree we end up getting, right? Yeah. And it's not like a tooth is just like an accessory, like hanging out in your body, right? And
it's not like I can manage a tooth anyway.
Yeah, right? And so there's a whole science to it, right? I love dentistry because it's like art and science. There's a lot going on with a tooth. Like I can, there's only so much I can do, but overall, like it's not just like an isolated tooth. There's a whole environment there, right? And I'm not taking care of just that tooth. I'm taking care of the entire environment of your mouth. Yeah. And I'm taking into account your medical history. I'm taking into account all these other factors that, that's what a doctor does. I'm not just like a tooth mechanic, right?
So what you're saying is that, okay, maybe the journey is a bit different, but the net result is still a physician.
Yeah, you're still a doctor at the end of the day. And I think it just depends on what kind of doctor you want to be, right? Yeah. And I think for me, the thing that stood out the most in dentistry was how, it's fun because it's artistic, right? You get this like complex case or even a simple case, right? But it's super important to kind of focus on educating the patient on like the importance of oral health, because I think people come in and they're like, oh, I want my teeth to look pretty. But there's just, maybe so many other things that they haven't considered because they just don't know, right? Yeah. Or people always come to the dentist when it's too late. Like at that point, your options are super limited. And I think, going to a general dentist for annual checkups should be like going to a primary care provider for annual visits, right? Because that way you can stay on top of it, make sure that you're healthy, that that things are going well, that you're not coming to me when it's too late and your options are very limited.
Well, the issue is access worldwide.
That is true.
It's difficult.
It is very difficult. I will agree with you. And a lot of times, like a lot of people don't have insurance or the finances to go to a dentist. And that's a whole other issue as well, right? Yeah. But I think, in general, like just education is something that can go really, really far, because no matter how much, a lot of people or some people have the finances, but they don't have the knowledge to know that this is important, right? Or the time. They think it's not worth their time. Yeah. And so I think a lot of people just don't realize the importance.
They see it as a luxury.
Yes,
a lot of people.
Exactly.
They see good teeth as like, I'm Hollywood. I spend the money on it. But it's not core to,
Yeah. And I mean, you can have not the most aesthetic teeth, but your mouth can be healthy, right? And you can have like really good looking teeth, but your gums and, the state of your mouth can be not so healthy. So I think that's also something that, needs to be emphasized, is just there's a lot more to it than just, like white looking teeth in a mouth, right? There's just a whole person. There's, tissues, there's nerves, blood, bacteria, like so much in there that is also important. And so I think for me, realizing that, this is an area in healthcare that a lot of people kind of neglect, or think is a luxury and pushed to the side. And I really wanted to play a role in educating people around me, and giving back to like just the community in general, education wise, opportunity wise. I just really want to emphasize the importance of like oral care and oral health. And just, yeah, I really enjoy it.
I'll extend an olive branch here.
Okay. We're due for an olive branch at this point. Yeah.
No, like, because a lot of what you're talking about is reminding me about how I feel about psychiatry. I'm not a stranger to people being telling me, oh, like just the other day, literally, I had a friend of mine tell me, if you're enjoying this, it's a shame if you go into psychiatry. And I get where people are coming from. I'm not gonna lie, I get it, but it's still health, and it's weird in health. I feel like if you have one thing off, it's a domino to the rest. You know what I mean? Like, that's why, like, if someone has, I don't know, let's say someone is bedbound for whatever reason, they're gonna feel depressed. They're not gonna go to their dentist. They're not gonna get exercise. So maybe they need physio. That's off. Their diet is gonna be bad. Dietitians are there for a reason. You know what I mean? Like, all these areas, that's why we have multidisciplinary teams and blah blah. So I do feel you with that, to be honest. I understand what it's like. Now what I'm wondering is, okay, I'm putting myself in the position of, let's say, someone who's deciding between medicine and dentistry. How do you get over that feeling of, oh, people are going to tell me I'm not a real doctor?
Okay, so I experienced something similar when I was like, okay, so my second year of undergrad, I decided I no longer want to do medicine, and I want to switch paths and switch gears and go into dentistry.
Right.
And I heard it from a lot of people who were like, oh, but if you're going to go and do 4 more years of school after undergrad, might as well go and become a real doctor. And I'm like, okay, I could let this bug me and sway me from doing what I actually really want to do, or I can just work on having this conversation with them, or wait until they actually see me succeed in whatever it is that I'm doing, and then realize that no, like, I'm actually a doctor, right? And so I think, for the longest time doing dental school, people would joke and be like, oh, but you're not a real doctor, whatever. But I think the more I learn and the more that they see me do, and the more, I guess, confident they see me and like the steps that I'm taking and that I'm succeeding, they're like, oh, wait, like, you're actually a doctor. There's some respect there. I was like, yeah, maybe when I'm actually, done and graduated and working, you'll fully believe it. But I think if it's something that, you truly enjoy, it just shouldn't matter what, people think if you're not a real doctor or you're a doctor, because within yourself that you've done the work, you've put in the time, you've put in the hours, your information, and you're a competent provider. And that's what matters. I can't
agree more. That's exactly what I did.
Yeah.
Whenever I'd have that feeling of, because I've had this discussion before of like, oh, my ego and blah, blah, blah. Because like, at least there's no slurs for dentists, but like, I'm a quack. You know what I mean? Like, that's been used against psychiatrists. There's museums dedicated. There's a museum in LA.
What is it called? What is it called?
It's an anti-psychiatry museum. Psychiatry, an industry of death. I think that's what it's called.
What?
Yeah.
That's so interesting. I'm gonna check it out.
Yeah, no. I funny enough, I went to it because I was doing a summer course in the States at a university.
Okay.
And we went to it to kind of, it was a psychology course, and to get the opposite's opinion, right? And so we went through this whole museum of them talking about how evil psychiatry is and how bad it is and blah, 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 blah. They didn't sway me, but I mean, I get what it's like to kind of have that stigma against what you do.
Yeah.
And not be given, I don't like saying it's the respect I deserve, but I mean, when I went to med school,
yeah,
I'm a doctor.
Yeah, you know your stuff.
Yeah.
Yeah. No, I get that. And I think it all stems from the fact that just a lot of people don't see mental health as important as overall health, right? But
sure.
I think if you're going to define health, then you define it holistically, right? Like your mental health, your physical health, like your oral health, like everything. It's not just your body and how you're feeling, right? Like, your mental health can take a toll on your physical health too, and vice versa. So I don't know. I think we separate things too much.
But I also think there's also one thing that I have noticed, a trend. I feel in health, we need to have, anyone who works in health will tell you that all components of healthcare are important. I think honestly, if your doctor is dismissing a dietitian, they're not they're not up to date with their stuff.
Yeah.
Everybody, a good doctor knows their limitation.
Yeah.
You know, like if I have a patient who, I don't know, they have tooth pain, I'm not gonna be like, oh, I can handle this, I'm a doctor. You know,
Yeah.
like you need to know where your limits are. So I feel like one issue we do have is in the naming of things. You know, like like people get confused between PhD doctors versus physicians versus dentists versus pharmacists. The only ones they don't get confused with are vets because they have a whole different.
They do their own thing.
They got their own.
Yeah.
You know? And I think that's also like a problem. Like our naming, maybe part of the issue that we're talking about here is the naming that is going on. You know, because like let's say someone is, has an has a degree in diet, dietitian, and then they get a PhD. You know, are they suddenly a treating physician who's gone to med school and can prescribe? No, but then some people may take advice from them, thinking, and not to the rarely to their fault. I don't think they're trying to advertise that, but this is kind of the issue with the naming. Like, see how just from naming, we're seeing people getting wrong advice from wrong places. Naming can cause people to not pursue the things that they love because of stigma. I think in healthcare we need to change the way we name stuff, and our titles need to be updated. Yeah, I don't think it's conducive.
Yeah, and I think overall in healthcare too, we really need to just have more cross collaboration between like all the disciplines. I think we're just too separated, and that also is one of the roots of the issue with like the whole stigma thing, right? Like, oh, I'm not gonna be a dentist because they don't consider me a real doctor, they don't take my opinion for stuff. But no, if we really sat there and took the time to like have that conversation, have that collaboration, then you will feel like you are
a physician.
Yeah, and you have a seat at that table, right? And I think that's really important and something that we're slowly working toward. I mean, at least at our school, we're slowly working towards that, or we're trying to work towards that.
I think medical schools are generally around the world. I think there's around the world, there's more and more push towards the idea of the MDT, the multidisciplinary team.
Yes.
And that patient care is not from one angle. You need nurses, you need doctors, you need dietitians, you need dentists, you need physiotherapists. You need everybody to be contributing.
Yeah, no, I agree. I just think this whole separation thing causes more issues.
Well, I was thinking about this before our episode today. One thing that is kind of strange to me. So, dentistry is kind of like an area of medicine on its own, and then, and you guys, our paths are similar at the start, and then they veer off. What I've wondered, though, is why isn't dentistry treated like a specialty of medicine? I've wondered, like psychiatry, you go to med school and then you go and you do your psychiatry residency. Why is it that dentistry would be treated any different? It's kind of confusing to me. I wouldn't it in fact enhance the one thing that I'm thinking is like the big thing that I'm taking away from like intern year right now, training year, is like I can handle a lot of emergencies. At first, if a patient's heart stopped, I'd be freaking out. I don't know what to do. Now I feel relatively confident, and just that experience, seeing all the disciplines, blah, blah, blah. So I'm surely you guys would benefit from that kind of, experience, right?
Yeah. I think in terms of, medical emergencies, basic life support and stuff, we do get training on that, but again, very limited. And it's very like, unless you're really in that situation, you won't really know how you're going to react. Like there's so much you can get from a textbook or from a training course, right?
And how many times do you realistically see that?
Yeah. Not often, right? But I think the reason it's separate is because, or at least for us, like our curriculum as dentists or dental students is that, our first 2 years is strictly like preclinical didactic stuff, right? But then we're also doing a lot of lab work because our second 2 years, we're treating patients already. So we are learning a lot of these root canals, making dentures, doing crowns, things like that. We're learning them on mannequins and like fake teeth. And so that also takes up a lot of our time. We're doing a lot of lab work.
Well, why couldn't you do that during, let's say, residency, for example? Why do you think? Why not?
Because I feel like it would take up, like, we would be learning a lot of stuff that won't necessarily be applicable by the time we, start doing all this lab work and stuff during our residency year.
But that's what I mean.
So
Like
long gone.
all the specialties are that way as well. You think orthopedic doctors know how to handle hypertension? Sorry, to my orthopedics out there. Oh my god. No, I'm making fun because a friend of mine finished his orthopedic rotation and he was like, "Oh yeah, if a patient has is sleepy, psych consultation."
There you go.
Yeah, but yeah. So like, why do you think that we allow that redundancy for other specialties, but then not for dentistry?
I mean, I don't know. I guess within your specialties, like being in a hospital setting, it's a lot more, I guess, applicable, like the stuff that you learn and especially on your like rotations and things that you do, versus for us, it wouldn't make sense to go into all of these rotations. Right. When at the end of the day, we're still focused primarily, very heavily focused in the mouth. Like
I didn't factor that, the setting. Yeah. Yeah. You guys are totally, out. Totally
separated for the most part. I mean, there's a lot of still hospital-based dentistry and stuff, but again, very different setting. Yeah.
That's interesting. Yeah. But again, a lot of this is reminding me of psych because psych stuff is usually separate, and I wonder, like, maybe that is the future of medicine, of healthcare, like, of if you want to do that one thing, get started on it, and we'll, just do that, study that. Maybe that is the future. Who knows? Maybe. Now, in terms of the other stuff, like we you shed light on kind of like how you felt about dentistry, whatever. What about? I love what you mentioned that in the first 4 years before dental school, you had that freedom to kind of explore, right? But a lot of people don't. A lot, like most systems outside of the U.S. are out of high school, you got to choose.
Straight into it.
Yeah. So what do you think should run through someone's head thinking like, should I do dentistry, medicine?
I think, if I were to go back to high school me, I would have, tried to be more open-minded and aware of the different, routes of healthcare that exist, right? I think... I mean, we're very young in high school. We're like 16, 17, 18, Children. What do we know?
Children. We need to specify that because we go into med school as children.
And I think it's really hard as an 18-year-old to know what you want to do for the rest of your life. Very, very hard. I don't think... I'm forever grateful to have gone to the U.S. and had those 4 years to really, 1, grow up, and 2, figure out what it is that I want to do, because I would have been really, really upset if I ended up in a 6-year program doing something I did not want to do, right? And so I think in high school, I would have appreciated someone just, 1, reminding me to constantly be open-minded and aware of all these like different routes, and 2, to just be curious and try to go out there and see what I would want to possibly do, right? I feel like maybe if internship programs existed where you could do, rotations in different healthcare disciplines, or I think this podcast is great because you get to hear from different people who've had different routes at such an early age. It's so easy to hop on Instagram and like find this and like just listen, and then maybe, be more curious for other fields. And 3, if you're interested in something and you don't think it's what someone else wants you to do, then who cares, you like it, you pursue it, and you run with it, But I think if you're gonna live in fear that, hey, I'm gonna go to 8 years of school, but then I'm gonna be a dentist, not a doctor, and you're gonna stop yourself from doing what you want to do because you're afraid of that, then that's on you. You're not gonna have anyone else to blame but yourself later.
Yeah.
So, yeah.
I'm really glad we're talking about this, though, because I feel like I don't know how, maybe this wasn't the case for you, but I felt like this is a conversation that we can't really have or speak honestly about, because when you did, at least in my experience with psych and stuff, if you bring up the subject, someone will just be like, oh, no, don't worry. Yeah, no, they're for sure they're real. They either just give you one or the other, but they don't have that nuanced discussion of like, okay, yeah, this stigma sucks.
Yeah.
But there's benefits to, sticking to what you love.
Yeah. No, I completely agree with you. I think because it's what you're going to do for the rest of your life, right?
That's so scary. That's one thing. It's frustrating because, okay, fine, cool. You love dentistry now. can you predict the next 15 years of your life?
I can't, but right now and, for the foreseeable future, I feel like I do really enjoy it. And I mean, I'm still at school. I haven't been, doing anything really, but
Yeah.
I love what I'm doing at school, and I'm going back next week, and I'm really excited to like get back to it and patience and that
Really?
routine. I'm excited. Yes, I love being on break, but I think I really enjoy that, that aspect of talking to someone and having a conversation about their health, right? And just doing everything I can to help them. Those like instantaneous results sometimes that really transform a person's life. I really miss that. And that's something that for the foreseeable future, I do see myself doing and really enjoying. And I'm excited for what it's like to be post-grad, a practicing dentist.
And in terms of lifestyle, what do you think? Because I remember when we spoke about this when you first made this decision years ago.
Yeah.
There was a lot you mentioned about lifestyle
Yes.
that appealed to you.
Yeah.
So like what are some of those things?
Yeah, so I was talking to my mom about this, right? So she's an anesthesiologist and she was raising a family at the same time, and it was really, really hard on her because there was me and my sister.
I can't imagine.
Yeah, it's really, really tough, right?
Yeah.
And then there's like the on-calls, there's the long hours. And so as a woman, it's really hard if, the plan is to like have a family. It would be really hard to just have those like insane hours and do that, at the same time. And I think the thing about dentistry is there's a little more flexibility, right? I mean, I guess not at the beginning as an associate, of course, but, if there's different paths in dentistry, and I hopefully one day want my own practice, and I hope to have like associates helping me out and things like that so that I'm able to balance it more and I'm able to have a better work-life balance. And of course with dentistry, there's no on-calls. I'm not going to get a call at 3:00 in the morning to come and do whatever.
This is why doctors bully dentists is because you know what?
You're just
we
jealous
suffer.
because
we
have
are jealous.
it better.
Nobody's going to deny that. Nobody is going to deny that
Yeah.
we're extremely jealous.
Yeah, see, so that's like something that really, really drew me to that as well. As I've always like thought about in the future, when I do have that like family, I want to be more present, and I think that's easier to do in the in a dental career than a medical.
So okay, let's switch it though, because everybody would love to think, okay, I don't want the hustle and bustle lifestyle, whatever. But there's plenty of people that they're like, no, you know what I want? I want that adrenaline. I want that 2 a.m. I'm gonna get a call, save this life, all that. So do you think that someone who's more appealed to that adrenaline rush, blah blah, necessarily excludes them from going to dentistry?
I don't think so, because there's so many different fields in dentistry, right? Like you can go into like oral surgery, you can do hospital-based dentistry and be on call and get like trauma cases that you have to like work on, right?
Like what?
So I know people who it's also peds. Apparently like the residents will get, pinged or whatever for like emergencies or things like that, especially with kids, like they'll fall, they'll like hurt their tooth, or like if you're an oral surgeon, accidents happen, stuff like that. You got to fix it. So if you want to do dentistry, but you want that adrenaline, you can go into a specialty in dentistry that'll give you whatever kind of rush you need. It just depends what you're interested in, right? For me, I like general dentistry. I really want to do everything that I want to do and then refer out what I don't want to do. And so that's what I want.
But what I'm wondering is kind of also how do you get intrigued by the subject material? So like one thing that all medical students struggle with throughout medicine is that you're doing all these rotations, cardiology, endocrine, psych, blah, 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 blah. And every medical student will tell you that like, let's say 3 out of the 5 rotations they do, they leave thinking this is what I'm going to do for the rest of my life. They get sucked into that, you know what I mean? But then with dentistry versus medicine, you kind of got to choose what part of health you want to get into, like what part of the body specifically you want to get into early, you know? So like, what do you think, like, what about, this sounds so weird, what about dealing with mouths all day appealed to you, you know?
Honestly, a lot of it. And it's not just the mouth, right? But I think for me, the biggest one was instant transformations. I think I'm a very...
Okay, that's a good point.
Yeah. I think I'm a very like detail-oriented person, and I really like seeing results almost immediately. So a lot of times it might not be possible, but I think like what when I was doing that internship at the hospital, and I was in the dental clinic, and I told you, like, one of my days I was shadowing that general dentist, and that patient literally came in with like half of their front tooth like completely chipped off, right? And they were sad and whatnot, and in an hour it was fixed and they were happy, and the lady was literally crying because she was like, oh my God, I'm not ugly anymore.
Yeah.
And I think that instant gratification, it was just something that I really liked. It's that transformation that's almost immediate. And I think that's something in dentistry that drew me to it. But but it's not just that. I think it's just there's so much room for like being artistic, adding like that personalization.
You're the second person to mention this.
Yeah, you meet the patient halfway, right? Like I don't know. There's really a lot to it, and it really is artistic. Like, I think when you look at people who come in and they're like, oh, I want to transform my smile, I'm really not happy with my smile. There's steps to it, right? You don't just immediately stick like, white boxes on their mouth and like send them away. You sit there, you kind of identify what they want. Do they want a more full smile, a longer smile? Do they want it whiter? Do they want it more natural? Like, you can then customize the teeth and like have it look more or less white depending on what they want, really adjust the aesthetics. And I think there's just so much to learn there. And it's so interesting to me that I was honestly really drawn to it. And I really do enjoy working in, those like millimeters of like space. And
that put me off. Oh, okay.
And I think it's really rewarding and it's really cool. And I really like having those conversations where I'm explaining to the patient why it's so important to like brush and floss twice a day, or why it's important to use fluoride, or why it's whatever, because you think it's common sense, but to a lot of people it's not.
Sure.
A lot of people it's like, oh yeah, I brush once a day, I floss once a week.
Yeah.
Okay, but do you know what happens when you only do that? It's like a whole conversation. And then they're like, oh, I didn't know that all of this can happen from just this, right? And I think it's those kinds of conversations that I also find really exciting and interesting.
I just wish dentistry had better access.
Yes.
Healthcare has horrible access across the board. But I mean, like, see, a lot of what you're talking about, I can't relate to, because in terms of dentistry, I've been very fortunate. Usually the dentists who have treated me are my family. So like these conversations I can have to the side, or,
Yeah.
But whenever I've gone for a dentist who I'm not related to, there's a bit of, to be honest, I've never gone to a dentist that I'm not related to.
Really?
Only hygienists.
Oh, wow. Okay,
Yeah.
no, I've only been to dentists I'm not related to. And honestly, I never had these conversations with them.
Okay.
Which is really interesting. Well, it depends where, but a lot of times it's like in and out. Like they'll just come, they'll do their thing. For the first like 18 years of my life, it was either my pediatric dentist when my teeth were like falling out, or the orthodontist when I got braces. And then when I went to undergrad, I had good dental insurance. So I started regularly going to the dentist, and I honestly really enjoyed going I should have known, that my first year when I went to the dentist and I left feeling great, I should have known that this is what I wanted to do. But yeah, I think it was just very like, it was interesting because they assumed that I didn't want to know about my teeth. So they took a bunch of x-rays and then they did a cleaning and they're like, you're good to go. And I was like, okay, can you tell me a little bit about what you found? And then they were kind of taken aback. They're like, oh, you want to know?
Yeah.
And it's like, yeah, I feel like, why would I come here if I didn't want to know? There was nothing, I didn't feel any pain. Like I came here because I was here for my annual exam. You wouldn't go to a physician and then have them run tests and then you just leave and they never tell you what happens.
That's the old model.
Yeah.
That was what was happening for many, many years. And I see the effects of that on my day-to-day. The shift in healthcare. And I think it's what created a lot of mistrust. I think in the years to come, we're going to see the shift away from that.
Yeah.
Because again, I'm sure you guys studied this too, the shared decision-making model.
Yeah. And you need to have, communication and informed consent. Like you need to have these conversations. You can't just go in, sit there and leave and have no idea like what just happened. And so I think like after that first experience, I was like, okay, no, when I go into healthcare, because again, at that point, I still didn't know if I wanted to do dentistry, but I was like, when I go into healthcare, I want to make sure that I'm very, open and upfront about what I'm seeing. And so I make it a point, whenever I have like a patient in my chair, it's easy to like pull up an x-ray, and when they see something dark, they're like, oh, that's a cavity, right? Like it shows.
Yeah.
So I make it a point to like pull it up, and I'm like, so this is what's happening in your
To
mouth. Like, this
communicate
is
with
what I'm
them.
seeing. So this is why I'm going to do this. I don't just sit there and I'm like, cool, okay, like we're going to do 3 fillings and that's it.
Yeah,
and then
move it
I just
along,
expect
yeah.
them to trust me. I mean, yeah, okay, they trust you, but I think it adds that like added step, right? When you're like, here's what I see, and this is why we're doing this. And it could be deep. You might need something like a root canal later or whatever,
Yeah.
but we're going to start with this, and I think it's just really important. And that's something that they really teach us at school too, is just, meeting the patient halfway, like just really explaining to them what you're going to do and having them understand what you're going to do so that they're able to make a decision that they really understand.
Yeah, the thing about shared decision making is that it's gonna hurt care if you don't do it. It's not good, detrimental to actual proper healthcare. And I can like definitely like, I'd want to know more about my teeth. I remember the other day I'm gonna do Invisalign soon. I'm really nervous.
Why?
Because I was always told I don't need the braces, and so I was like, I don't know. I've been always put off, but I've always wanted more of a Hollywood smile, I guess.
Straighter teeth.
Yeah, I've always wanted that. So I was like, all right, why not? And so when they took the X-rays, I was actually interested. And but you make an interesting point, by the way. If that's a good thing for someone who's considering, hey, maybe I should do dentistry or medicine. If you go into your local doctor's office versus your dentist's office, where do you feel at home? I feel like something in your gut could tell you.
Yeah.
Yeah.
I don't like going to the doctor.
Huh.
Yeah, I should have known. I should have known, right? I mean, I go. It's not my favorite place to be, but I go. But when I'm at the dentist, I'm like happy, cheery. I leave with a little goodie bag,
That's
it's
true.
nice.
That's true. Yeah. I like the goodie bags when you leave the dentist's office.
Yeah.
It's really nice. Well, I think we've talked about a lot of interesting things. To kind of summarize our paths here, we were both coming up, interested in going into healthcare. You were even more adamant about being a doctor than me. I'm not gonna lie.
Yeah, no, I was very
Gung-ho.
into it. Yeah.
Yeah, and I like how we split off actually, because it enriches my life to know a dentist, and to know like from my childhood, and to know kind of where we're heading off to, and kind of the steps we took, because tomorrow people are going to come to me and ask, should I be a dentist, should I be this? And I think just through this conversation I'm going to be able to tell them a little bit more about why they should go into medicine or dentistry.
Yeah.
The way that I see it, if you're interested in being first more creative,
for sure,
I think there's a very big creative element to it from what I got from you. And by the way, Dr. Amna Mtawwa, our episode with her, she said the exact same thing as you. You're an artist.
Yeah.
Instant gratification. Is it fair to say greater flexibility with work-life balance?
I would say so, but it also depends what field or what aspect of dentistry you go
Well,
into.
you can adjust the meter as you like.
Yeah.
Yeah. And the last thing is, and this is coming from someone who wants to go into psychiatry, just ignore the stigma. You are a doctor, and it doesn't matter whether people believe you or not, because the evidence is there.
Yeah, you are a doctor.
And even, you know what? Even, let's say, the traditional doctor, the cardiologist, the this, that, if they're bad doctors, they're not a doctor because they're bad doctors, because their patient no longer trusts them and not letting them treat them, Yeah. So what's important is your practice and what you do.
Exactly.
Yeah. Thank you so much for coming on, Monica.
Thank you for having me.
Yeah.
This was fun.
Please make sure, if you like what you see here, please send it to someone who would find it useful to them. Remember, guys, the Doctor's Brew is about helping people, getting information out there. So if any of this was interesting, someone who's debating between dentistry and medicine, and listen, this is coming out in the summer. Everyone just graduated. This is registering for Betha times in Kuwait. Like, send this to them, so they can help decide. Please make sure to like, comment, and subscribe. And that's the final sip of coffee for the day. A last special thank you to our guest.
Thank you.
And we'll see you guys next time. Hope you all enjoyed this episode of The Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.